So what we're doing is repeating the work of not only my dad. So I'm a second generation, I guess, orthomolecular physician, you would say. My dad, Charles Mary Jr., was the director of Charity Hospital in the early 70s. He was 32 years old. Very young, very smart, really always ahead of the game. And so I have the great fortune of having him live next door to me. He's in the apartment in our home. So still alive, still conferring about all kinds of great stories. But early in his practice in the early 70s, he started using megadoses of IVC in the clinic and then brought it to the hospital. Now, he's told me he's never had a septic patient die. No gram-negative sepsis deaths. So that's a pretty big statement, but he's not a researcher. So the city of New Orleans knows him, the state, the ripple effect is massive of the people that he's helped, but because he wasn't written, a lot of people don't really know past that. So he has the experience, and so that's what I'm trying to share, and that's why I opened up the clinic it's called the Remedy Room. I opened it because I wanted more people to be able to experience the benefits of high-dose vitamin C without having to, be in the hospital, to use as a preventive aid and start to talk about changing the face of medicine to where you really have a relationship with the doctor. It's not this patriarchal, you do what I say. It's more of a two-way street where we communicate and we kind of meet the patient where they are, but really try to lead them towards lifestyle behavior changes, preventive stuff. So at the end of the day, if I've done my job right, I've taught you, which doctor means teacher, I've taught you how to use the tools that nature's given. And then if I fail that, if that doesn't work, okay, then I'll go to prescription agents. I use them, but not on a regular basis. And I manage them as we get the patient better, right? Because everybody else already has their own doctor. All of my patients get put on oral C to bowel tolerance who are sick. We have them load the doses every 15 minutes and maybe for an hour or two, and then hourly. And then if obviously all of the ones that are coming are getting an IV, I'm asking the very sick ones to come bare minimum of 3 days. And then the others come in, everyone else has come at least 2. The results that I'm seeing are basically the same as the results that I see when people come in with flu, very sick. A lot of them are dehydrated. They've been fighting this for a while. I've had a few that have had loss of taste, loss of sense of smell. It's improved. It's not all the way back, but just the fact that they're getting better with that. The fatigue that they describe is better. And all of the ones that have come in with high fevers, after the first IV, there's no more fever. So I'm seeing really amazing results. The issue I even have one gentleman who's actually not able to come in anymore. He's just coming in. We're working with a home health service to get him the IVs to his home, and his daughter's caring for him. But she texts me, what happens with this gentleman. He's quite old and he is frail. And so his primary has been offering him IV fluids, and then she gives him our IV with the vitamin C and the nutrients. And she writes, she's like, this stuff is truly miraculous. He's been getting the fluids, but now he's up, awake. He says he feels fine. He wants to get out of the bed and walk to the bathroom by himself. So, you can watch it happen, in front of your eyes. They turn pink.
So I think the important summary is that you've been doing this for other viral and bacterial infections for some time, and your dad, obviously, for a long, long time. And the results that you've seen historically over 10, 20, 30, 40-year career in this space is the same for the COVID-19. You're not seeing this thing being refractory to the same type of result you're getting with the common cold or the flu.
Correct. And because they're scared, they're coming multiple days in a row. So that would be the only other part that I would say. Some of my patients, when they would come in before with the flu, it might come one day, and then I don't know if they keep up with the oral dosing. Now I find it's quite consistent.
Yeah, so what you're saying this is slightly more aggressive.
This is more aggressive, and I think people are more afraid. So that's increasing the stress. That's increasing all the, inflammation a little bit more. And then the isolation part of it all, that part is, they're not getting the emotional care that they need, right? People, it's kind of like the scarlet letter. You cough and people run away from you. So I think there's a lot of components that are a little different.
Right, yeah.
The Lancet actually listed vitamin C as you're allowed to give it as a rescue therapy for COVID-19. Lancet. We couldn't believe it, but early on, I'll send it
to be a little more open-minded. Yeah, that's good.
It's happening. So it's just a small bend, but it's happening. And then the earlier reports, like in January and February, I think I told you. So Dr. Richard Chang is this. He's an American doctor in our group of the orthomolecular group. and he was in China for the New Year, and then got stuck over there and was instrumental in getting the 3 studies started. So there's 3 studies right now from 12
Right.
to 24 grams, right? So maybe actually even one at 6 grams. And then he got Dr. Mao on the phone before he went for rounds. And this gentleman spoke about how he had 50 out of 50 moderate to severe cases that were all well, no deaths with megadose C. And only in one case that he gave the guy 50 grams, and he gave it over 4 hours, which is about what we do, 2 to 3 hours is what we do with a patient with cancer. So in the clinical setting, it's just, that's commonplace, right? So they gave it over 4. He said all the stats got better right in front of their eyes. So it's going to take some seeing to believing for these guys. I mean, they got to, I said, they got to see for themselves, and we'll make that a new hashtag, like vitamin C.
All right, my dear. Great
Take
chatting
care.
with you.
Talk to you soon. Have a great day.
You too. Bye now.